I'm lucky to be under house arrest with my favorite people in the world, or some of my favorite people in the world, my family. We had to stop several projects kind of mid-experiment where, we have people who are depending on us to do those experiments and get the data so that, in some cases, so that we can publish a paper and get a grant renewed. And in other cases, we have clinical collaborators who are counting on us to be able to test the functional impact of a gene that they've sequenced in a patient. And they really need to know the answer, and we need to be able to be in the lab in order to generate that data to find out what the answer actually is. Sometimes a diagnosis, hopefully a diagnosis, means that that it helps the physicians who are actually seeing those patients direct their care, and so that's obviously critically important. People who do scientific research as a career, they're a really special breed of people. And one of the things about experimental research is even people who are really talented and really smart, experiments fail for all sorts of reasons all the time, despite the fact that you're doing them correctly, you're really good at it. And so it takes a really special kind of person to be able to deal with failure on a daily basis, and to keep coming back and asking for more, because they're just really passionate about science and about solving puzzles and making discoveries, and advancing science for the good of humanity. I think one of the things that I hope people have taken away from all of this is, the importance of scientific research. Research that someone does today because they believe it's important and it interests them. And maybe sometimes they can't even articulate why it's interesting to them. And, quite often, the discoveries that you make in the context of doing that type of research ultimately becomes important when there is a crisis. The investments that your tax dollars and that your donations make to supporting science now could have immediate benefits, like the benefits to those patients who are waiting for this diagnosis, for example. But also, you just never know long term, when something is going to be a key discovery that really helps us all get out of the state that we're in right now.